Hi everyone, we're going to discuss cholesterol today and how we can lower it using prescription medications and other things. Let's go. So cholesterol is just a lipid or a fat that's essential for the body's normal functioning. It's found in every single cell in all living organisms and plays a lot of important roles. It's a crucial component of cell membranes. It gives them fluidity and integrity. It's important for hormone production. So it's a precursor for the synthesis of steroid hormones such as estrogen, testosterone, and cortisol. Cholesterol is converted into bile acids in the liver, which are essential for digestion and absorption of dietary fats. And it's crucial for the production of vitamin D as well in the skin when exposed to sunlight. So it travels through the bloodstream on something called lipoproteins, which are a mix of lipids and proteins. And there are several types of these with the proteins, including LDL, or low density lipoproteins. These are the bad cholesterol because high levels can aid to plaque buildup in arteries and result in heart disease and stroke, that sort of thing. Then we have the good guys, the high density lipoproteins or HDL. These help remove cholesterol from the bloodstream, transporting it back to the liver where it's excreted or reused. Just for completeness, there is another type as well called VLDL or very low density lipoprotein. These mostly carries triglycerides. It's another type of fat and it contributes to plaque formation as well. But what can contribute to high cholesterol in the first place? So if these just might seem like common sense, but let's just go through them all. So for your diet, consuming foods high in saturated fat, trans fats, then cholesterol can obviously increase blood cholesterol levels. Foods which are the culprit are things like red meat, full fat dairy products, fried foods especially, and processed snacks. Being overweight as well is obviously an issue. It's associated with higher levels of LDL cholesterol and triglycerides and lower levels of the good HDL cholesterol. Regular exercise helps raise the good cholesterol and lowers the bad. So sedentary lifestyle can contribute to weight gain and higher cholesterol levels. Cholesterol levels actually begin to rise with age. So before menopause, women usually have lower total cholesterol levels than men of the same age. However, after menopause, women's LDL levels often increase. And genetics play a part. There's something called familial hypercholesteremia, which is a genetic condition that can cause very high cholesterol levels. It doesn't matter how healthy you are or how healthy you eat, it will be high. Other genetic predispositions can also influence cholesterol metabolism. We also have smoking, which actually damages the walls of the blood vessels, making them more susceptible to the accumulation of fatty deposits. It also lowers HDL levels. And obviously alcohol is just so bad on so many levels. Medical conditions as well can contribute to increased levels, such as diabetes and hypothyroidism, and some medications as well. Beta blockers, diuretics, that sort of thing, some antidepressants. Let's quickly look at the medications you may be prescribed by a GP to reduce your cholesterol. You've probably heard of statins, one of the most commonly prescribed medications. They reduce LDL cholesterol by inhibiting an enzyme in the liver called HMG-CoA reductase. They do have a few side effects associated with them, as with most things. The first one is muscle pain and weakness, and this is called myopathy. This can cause muscle aches, tenderness, weakness, which can range from just a mild discomfort in some people to severe pain. In rare cases, this can actually be causing a condition. It can cause a condition called rhabdomyolysis. It can also cause liver enzyme elevations. This won't be noticed by the patient. It's asymptomatic. It's detected through blood tests showing elevated liver enzymes. So regular monitoring of the liver function is recommended for those on statins. It can cause digestive issues such as nausea, constipation, diarrhea, or indigestion, and headaches as well, mild to moderate headaches. Those are the most common side effects, but it also causes some less common side effects as well, such as increased blood sugar levels. They can increase blood sugar levels, potentially leading to the development of type 2 diabetes, especially if those are already at risk. Some neurological effects as well, such as memory loss, confusion, or cognitive impairment. These effects are generally reversible upon discontinuation of the statin. And some digestive issues again, such as bloating or stomach cramps and skin reactions. This could involve a rash or intense itching. Let's quickly move through the rest of the prescribed medication then. We have a class of its own, ezetimibe, and this lowers LDL cholesterol by reducing the absorption of cholesterol actually in the small intestine. It can be prescribed on its own or in conjunction with a statin if you need to. As you can imagine, most of the side effects are GI issues like abdominal pain, diarrhea, flatulence more than usual, and muscle pain and asthenia. That just means general lack of strength and weakness. Next, we have the bile acid sequestrants or resins. Some of the examples of names are on the screen there. They lower LDL cholesterol by binding to bile acids in the intestine, prompting the liver to use excess cholesterol to produce more bile acids. They can interfere with the fat-soluble vitamins being absorbed from your food, A, D, E, and K, so you may need to take a multivitamin. And they can cause lots of GI issues as well and headaches. Next, we have fibrates. These primarily reduce triglyceride levels and can modestly increase HDL cholesterol, which remember is the good cholesterol. You would want to correct any hypothyroidism before initiating treatment. This is true with any cholesterol lowering medications. Hypothyroidism can cause an increase in cholesterol, so correcting this is obviously the first course of action. And more gastrointestinal issues as side effects there. What if you don't want to take medication or you want to try other things first? Brilliant, let's do that. Give yourself 3 months of lifestyle changes, and I'm going to go through some recommendations as well before you start your prescription medications, if it's okay with your doctor. First, let's start with dietary changes. Did you know that by increasing soluble fibre in your diet, you can reduce the absorption of cholesterol into your bloodstream just in a similar way as some of these medications do? So why wouldn't you try this first? 5 to 10 grams or more, if you can, of soluble fibre a day will decrease your LDL cholesterol. Consume healthy fats as well. Don't be scared of them. They're essential for a good diet. Just avoid saturated fats like fried foods. And there is also evidence to show that eating about 2 grams of plant sterols or stanols per day can lower LDL cholesterol, so look into that. Taking omega-3 supplements or increasing levels in the diet by eating oily fish, seeds, nuts, etc. can lower triglycerides and increase HDL cholesterol. Psyllium husk is a supplement which can be added to food. It's a soluble fibre which decreases LDL cholesterol similarly to the diet changes I mentioned. Just be careful, it can cause diarrhea and flatulence, so adjust into the diet slowly. Garlic has been shown to have a modest effect on lowering cholesterol levels, and here I go again, I can't talk. Red yeast rice supplement. These contain compounds similar to statins and can help lower LDL cholesterol. And there's artichoke leaf extract as well, if you choose. So the lifestyle changes are the usual for keeping your body and your mind healthy. Exercising regularly. You want to aim for at least 150 minutes of moderate intensity exercise of the aerobic type per week. So brisk walking, maintaining a healthy weight as well. Try and get support to quit smoking from your healthcare providers or support groups. And the same with alcohol as well if you need help. If you do drink alcohol, do it in moderation. Up to a drink per day for women and up to 2 drinks per day for men, but none if possible. Excessive alcohol intake can raise triglyceride levels and contribute to other health problems, I'm sure you're aware. So doing all this should reduce your risk of heart attacks and stroke and live a long, healthy life. Thank you.